When you think of rural America, you may conjure up images of farmland, nature, and friendly neighbors. These are all valid images. However, rural America also has an overstretched and underdeveloped health workforce and poor community health compared to their urban counterparts. Rural communities need direct primary care workforce development due to the lack of qualified workers and the need to increase health access and equity. Although rural settings all face these barriers, each has unique needs. This video focuses on the emergency medical service workforce needs of Monroe County and how CommHIT's U.S. Department of Labor Rural Healthcare Grant entitled Rural Roads to Connected Care, or RRCC, is being used to save lives of residents and visitors at the southernmost point of the United States. Monroe County Fire Rescue Leadership and Trainee explains how RRCC helps them and the Monroe County community at large.
The Rural Grant has just been an awesome partner. Gives us the opportunity, again, to train them with unbudgeted funding and still to meet our, maintain our standards as we deliver our fire rescue services. So we're bringing a lot of men and women that, you know, they sort of, we call it the Keys life. They live here, their roots are here, and really trying to develop a community-based department. Without that funding, we wouldn't be able to hit that objective.
We have a lot of personnel that travel 2.5 hours to come to work, and they're located outside the county. So for us, in times of emergencies, in times of, well, now we're increasing our staff and our members, tapping into what we have is what we need. That growth isn't just Monroe County Fire Rescue. That growth is the other fire departments within the county. That growth is doctor's offices. That growth is going to be within medical hospitals and the ERs and all these different things that these people are going to start tapping into and elevating their level of education, but the overall is the service to the community. Once again, it's just going to continuously be a process of development to where they're going to continue to grow, and going from the EMT, going to the paramedic, going to the critical care paramedic. I mean, these are all avenues that we weren't tapped into before.
Because we're so far from the schooling that's available in Miami, you know, that brings the schooling to the students here locally. And that's how we retain our personnel. The Rural Roads Grant helps us offset the cost to deliver that education and get these guys eligible for hire, and like I said earlier, you know, retention.
Learning these new things in classes and getting your certifications, when you actually walk up on a scene or see somebody that needs help and you know exactly what to do, it makes it a lot easier, and it makes you feel comfortable. It makes the people who are in that situation comfortable. I love it. I can't imagine doing anything else, and I want to look into doing the critical care program. Would like to join Trauma Star and work on my critical care once I get paramedic and get my experience in the field.
The longer it takes to get to definitive care, the poorer their outcome may be. So this is a critical service that we provide with very qualified ICU level nurses as well as critical care paramedics to provide that intensive care to the patients during their transport.
RRCC's mission is to increase the number of skilled workers in direct care health occupations throughout rural Florida. The occupations are ones that are drastically needed and equally underrepresented in almost all Florida safety net health organizations that serve rural communities. For grant participants, RRCC provides career pathways and stackable credentials to increase their skills and earning potential. For employers, RRCC provides an easy process for them to upskill existing employees and create needed entry positions with an emphasis on access, diversity, equity, and inclusion. CommHIT, short for Community Health IT, is a 501c6 at the Kennedy Space Center. Established in 2011, CommHIT deploys services in rural and underserved communities to develop strong yet flexible workforces and improve community health. CommHIT partners with Public Consulting Group, LLC, PCG, for their grant oversight, subject matter expertise, and technical assistance. CommHIT and PCG work together to provide rural Florida counties support to grow their direct patient healthcare workforce. To learn more about CommHIT's RRCC program, please go to communityhealthit.org/RRCC.